Hello, everyone. Just got cut off in that last bit there, but we're just talking about how um, important those things that the changes that Florence Nightingale made. So the same things that she did when she first went to the Crimea and sorted out the hospitals, she also did for the general public. And we're talking about how that actually increased, or helped to increase the how long people were living. Okay, it was that important, and we know from just hospitals today. If you go into a hospital today, you see how clean everything is and how sterile everything is. Okay, so when we're talking about things being sterile, we're talking about getting rid of all that bacteria. So that's especially important. If you went in for a surgery or something like that, the people that are operating on you would be washing all their hands with special solution and up their arms, and they'd have special clothes on that were all clean, and have all sorts of procedures in place so that they eliminate as many germs as they're possibly able to. Okay, so we see that in our modern hospitals now, and that's all from the impact that people like Florence Nightingale had, and especially her, with the innovations that she made to hospitals. We got all that understanding of how important cleanliness is. So when we're talking about what's the most important innovation, really, it is that idea of having sanitary conditions in medicine has had a huge impact on the number of deaths. Just like the when we talk about that situation in the Crimea that Florence Nightingale first went into, it's a good little example of how important sanitation can be, okay, in improving people's chances of living, especially when you've got open wounds and that sort of thing. So that's why we see in our modern hospitals today all that sort of cleanliness going on. So she really did change the way that everything was done in hospitals. She improved how people thought of nurses, and she made that much more important role because they had all of these things that they had to do as far as keeping the patients clean, keeping all the hospitals clean, and starting to get more involved in the procedures that were going on with people that were sick. So when we're talking about innovation, we would say that that was probably the most important innovation, the sanitation that was brought in, and you can see that from this example of the fact that even people's life expectancy went up when sanitation was improved in private housing. Okay, so for the plenary, just wanted to have a look at this interactive thing here, and it is a Florence Nightingale hotel, Florence Nightingale Hospital, okay, and we've got different things here that we can click on. So Florence believed that using clean tools in operations was very important. Okay, and we've talked about how important that is. Florence believed that hospitals shouldn't be crowded, so that's one of the things that she tried to stop as well, was having overcrowding, because that can spread disease and make conditions worse. Florence believed that hospitals need plenty of supplies such as bandages and medicines. That was another thing that she improved. She believed that nurses needed to be taught how to do their job well, and that we talked about how she actually brought in nurse training. Okay, they started having nurse training places after Florence Nightingale had her successes in the Crimea. Florence wanted hospitals to be clean. She believed in serving good food to the sick, and that would help them get stronger. And we know now that really nutrition is very, very key to people's health. Okay, people who have bad nutrition can actually die from things that otherwise people would be able to fight off. So that's why in these countries where people have got very bad nutrition because of the fact they've got famines and that sort of thing, you have a lot of people dying from diseases that they'd otherwise be able to fight off. Florence believed that patients needed to wash often to stop infection. Okay, and Florence believed that clean air was important for patients. So again, if you've got sick people, you need to have clean air circulating. We have that in modern hospitals now with ventilation systems and air conditioning and that sort of thing. And Florence gave people warm, clean beds. Okay, she also did a lot of things that improved people's general well-being. She made sure that the not only were the soldiers well looked after and that they had clean clothes and good food and that sort of thing. She also did things like had little library areas where they could go and read and that sort of thing. So if they were lying around, not able to do much for days and days, that they'd have something to sort of keep their brains active, which is important as well. Okay, so hope you were okay with all of that, and that you're going to have a look at your worksheets now and have a go at them. The easier one is multiple choice, and then if you're a bit more confident, you can just try to answer the questions from what you've remembered from the PowerPoint. Okay, so I'll let you get on with that, and I'll see you soon. Okay, cheers. Bye-bye.